So, I've been mask shamed more than once, and this is when someone is chided or made fun of for doing their part to wear a mask and help try to prevent the spread of a deadly virus. I'm Dr. Cheryl Wojciechowski from White Rose Apothecary here with my buddy Io, and I usually talk about the science of things that come from plants and how they can help our health, but today I'm going to talk about science. But I'm going to talk about the science behind masks and their effectiveness for COVID-19. So if I had the good fortune to reach you, I want to impress upon you that science is not a belief. It is something that comes about through rigorous experiments, testing, observation, and then repeating this process over and over again to make sure they have it right. And then before anybody is told about it, a whole panel of experts in the field look at it to make sure that it is rigorous. So it's as far from a belief as you can possibly get. In short, wear a mask. Why? It prevents the spread of COVID-19. And if we did it, we'd be in a much better situation. So a lot of the information I got from the CDC website and the Mayo Clinic and my website, wrapothecary.com. I'll put the sources of all of this information so you can look up the publications yourself. So remember that story, you may remember that story a long time ago where two hairstylists had symptomatic COVID-19, but yet they continued to see patients with a face mask on. They treated over 100 clients, and afterwards, 67 of them were interviewed. None of them contracted COVID-19. It's pretty amazing. Another example, infected passengers on a 10-plus hour flight did not infect crew members or other passengers if they wore a face mask. Now that's amazing, and we can definitely see that wearing a face mask protects other people, but can it protect you? In July of 2020, scientists from University of California, San Francisco published in the Journal of General Internal Medicine that they argue that from the evidence, wearing a face mask protects both the people in your environment from you and also the wearer of the face mask. And the data that they cited for that is, remember that Diamond Princess cruise ship a long time ago? Yeah. No one had a face mask. That was way, way in the beginning, so no one was wearing a mask. Only 18% of the people walked off that ship asymptomatic. Now, another cruise ship had a COVID-19 outbreak, and this time they gave everyone on that ship a fresh face mask every day. 81% of the people walked off that ship asymptomatic. Now, the amount of virus that you're exposed to can impact the severity of the disease, so argues this doctor. And how he argued that was some information that came out of an Indiana healthcare setting where a COVID-19 patient was infecting people. But the healthcare providers were all wearing masks. And even though they had the antibodies, so it was evidence that the virus was infecting them, they were all asymptomatic. So meaning that the disease that was contracted from the coronavirus was much, much less because they were wearing the face masks. So what should we wear? Duke University in September of 2020 came up with a study where they looked at 14 different kinds of face masks that are out there, all the way from N95s to nothing and neck gaiters. And what they found out is, of course, the gold standard N95 really stopped the spray that was coming out of people's mouths. So what they did is they had people put their chin on a platform and they had a detector. And they had to say the phrase, "Stay healthy, people," and they would see what type of particles, which carried viruses, came out of the mouth. N95 pretty much stopped it. But surgical masks were not far behind, and not far behind surgical masks were just good old cotton masks. And so they suggested what you should do is take a cotton mask, multi-layer, and hold it up to the light. And if you can see holes coming through, that means the virus can too. So make sure you have a nice, tight cotton mask fitted around the nose and under the mouth. Please, up above the nose. I see a lot of people doing that. That's part of your airway. So anyway, you don't want this disease. According to the Mayo Clinic, COVID-19 is 5 times more deadly than the flu. Symptoms can persist for months, and it can infect anywhere blood vessels go. Heart, lung, brains, exactly where you do not want a virus. So in conclusion, wearing a mask isn't about personal freedom. It's about protecting others and even yourself from this deadly virus. And I think we should all do what we can to preserve the public health. just as we now accept not smoking in public places and wearing seatbelts. So patronize the businesses that require the masks, and if someone's mask shamed, help them out. Again, the information that I cited is on wrapothecary.com, and until we meet again, stay healthy.